Tonight on this Denver7 in-depth report, another major step in our rebound from coronavirus.
Obviously, we're very eager for this vaccine to make it into the arms of 12 to 15-year-old children as soon as possible.
While health officials push to get kids vaccinated as quickly as possible,
we are in a race between the vaccine and the virus.
A lot of parents plan to take the conservative approach.
We want to wait till the last minute.
Thanks so much for joining us for this Denver7 in-depth report. I'm Jason Granauer. Today, a CDC advisory committee agreed with an FDA decision to allow kids as young as 12 to be vaccinated with the PFIZER vaccine. Earlier this week, the FDA gave the vaccine emergency use authorization for the 12 to 15-year-old age group. A study of 2,200 kids found the PFIZER vaccine was not only safe for them, but also that it worked just as it does in older people.
The efficacy of the vaccine in 12 to 15 years old was essentially 100%, and it was really quite safe.
Despite growing evidence of the PFIZER vaccine's safety and effectiveness in certain age groups, there are still a lot of parents out there that are hesitant to let their children get vaccinated. Researchers are hopeful that as more kids get the vaccine, other parents will feel safe getting their kids vaccinated. But others worry a slow process could negatively impact our efforts to end the pandemic and finally return to normal. Tonight, Denver7's Russell Haythorne goes 360 on the push to vaccinate kids.
Children as young as 12 could soon be vaccinated.
News of the FDA's announcement that the PFIZER vaccine is now authorized for children 12 to 15 years old has parents on all sides reacting to that expanded use.
I have two daughters. They're 8 and 5.
I haven't looked into the science about or how the studies have been going yet.
We want to wait till the last minute.
I just want to wait a little bit longer.
The news came with praise from some, hesitancy from others. So we're going 360 with doctors who argue it's safe, a mother who recently lost a child to COVID, another mother of a teen who developed blood clots, parents on all sides of the issue, and we start with the White House vaccine coordinator, Dr. Bashara Shukhair.
We know that the vaccine is safe. The vaccine efficacy is almost at 100%.
Despite that, there is a great deal of reluctance among some parents. A new Kaiser Family Foundation poll shows only 29% of parents would get their child vaccinated right away. 32% said they would wait and see. 15% said they would have their kids vaccinated only if their school required it. And 19% said they definitely wouldn't vaccinate their kids. That research mirrors exactly what we heard from parents.
Like if it's going to benefit them, yeah.
Concerned there's not going to be enough studies done, and I don't want to put my kids through that.
Side effects other than the ones they've shown come up, you never know.
We heard that if we don't do it, the kids can be able to come to school.
In a statement to Denver7, DPS, the largest district in the state, said, "We do not require the COVID vaccine for staff or students. We do encourage staff and students to get a vaccine."
We just don't know enough. I am in the group that is completely against injecting an experimental drug in my children.
There are certainly cautionary tales. Utah high school basketball player Everest Romney was recently hospitalized days after his first dose of the vaccine.
Just the worst thing is to have the doctor come in and go, okay, well, we found 2 blood clots inside his brain.
Doctors continue testing to find out exactly what caused those clots.
From what I understand, it is not a direct cause of the shot, but rather a perfect storm.
We strongly encourage all of our patients and all of our community to become vaccinated because the risks of the vaccination are much less than the risks of the disease.
On the flip side of that case, an Illinois family is urging parents to get their kids vaccinated after 15-year-old Dakota Morgan died of COVID-related complications.
She asked me why this happened to her. And what did she do to deserve this? And I told her that she didn't do anything to deserve this.
Doctors tried to move Dakota to another hospital when she passed away.
I thought it was just goodbye until I drove to the hospital. I didn't think that it was goodbye forever.
Dr. Reginald Washington is the chief medical officer at Rocky Mountain Hospital for Children in Denver. He believes adolescent vaccines are safe.
The messenger RNA vaccines have been around for quite some time. They do not change your genetics. They do not change your puberty status.
He's encouraging parents to talk to your pediatricians.
Get the facts from reliable sources. Obviously, the more children that are vaccinated before they go to school, the safer school is going to be.
Acceptance among parents is now being closely monitored by health officials. Russell Haythorne, Denver7.
We asked for your opinion on vaccines for kids, and here's what you had to say. Kay says it's every parent's right to decide what's best for their children. However, she hopes those who choose not to vaccinate are ready for continued mask wearing and COVID outbreaks at schools. Ashley says she refuses to get it for herself, so her kids aren't getting it either. And if schools require vaccination, she'll learn how to homeschool. Larry, on the other hand, jokes that if he had kids in this group, he'd have put fake mustaches on them to get them vaccinated sooner. Now, we want to hear from more parents and students about their vaccination plans. Send us an email at 360@thedenverchannel.com. Colorado kids 12 to 15 get their first opportunity for vaccination tomorrow. State officials want to make the process as easy for them as possible.
Any vaccine provider that receives a PFIZER allocation will be able to administer the vaccine to this age group. Our community vaccination sites also will be able to administer the vaccine to individuals aged 12 to 15 when the time comes.
Children in younger age groups still have to wait for the results of clinical trials before they can be vaccinated. Health experts believe kids 11 and under will be able to get vaccines by the end of 2021 or early 2022. The easiest way to get more kids vaccinated may be bringing the clinic to them. For the past several weekends, Denver Health has held vaccination events for teens older than 16 at 6 different Denver public school locations. Each week, between 150 and 400 people have shown up to get their shots, each with their own motivation for doing so. Following today's decision, Denver Health plans to open up these clinics to students between the ages of 12 and 15 as well. Right now, the only vaccine approved for use for those under the age of 18 is the PFIZER vaccine, but clinical trials are still going for multiple other vaccines for kids, including one that hasn't been approved for anyone yet.
Novavax is the COVID vaccine that no one's heard of. It's actually the fourth vaccine that is going through phase 3 trials in the United States.
Around 100 kids aged 12 to 17 are taking part in a clinical trial for Maryland-based Novavax. Experts hope what they learn will not only benefit kids, but help them better address variants in adults.
The hope is that with these newer vaccines, we will be able to capture the variants. And so we may get to the point where you get a PFIZER vaccine and then a Novavax booster, or you get a Johnson & Johnson vaccine and a Moderna booster.
Thanks so much for watching this Denver7 in-depth report. You can find all of our coverage of the vaccine process from the first development all the way through the latest decision by the CDC right now on thedenverchannel.com. I'm Jason Grenauer. Good night.